Thanks everyone for coming along. Well, first of all, probably briefly introduce myself then, but just like to introduce myself. My name's Tasha Jennings. As just said, I'm a naturopath and nutritionist and have been for the past 10 years. I have a background in clinical practice and product development, and I've also provided articles and expert comment for publications like the Herald Sun, Sunday Herald, New Idea, and more recently Cosmo Pregnancy magazine, My Child magazine, and Practical Parenting and some parenting websites. I also currently write for the Yahoo 7 network and Mouth of Mums, you may know of, and the Birthing site. My first book, The Vitamins Guide, is now available in Australia, the US and Canada, and I'm currently working on a second edition of the Vitamins Guide, as well as a follow-up book which is on conception, pregnancy and breastfeeding, which is now my specialty. And my reason for specialising in that area, I guess, was initially a selfish one, in that I was wanting to conceive. So I set about researching the best nutrition I could find to not only help me conceive, but also help me carry the healthiest baby I could. And that turned out from quite a small project, turned into quite a large-scale project as I met with researchers both here and internationally, and was really inspired by what I was finding out about the impact of certain nutrients on the short and the long-term health of your baby. And they're actually showing now that the nutrition you provide during those important few months can have a greater impact on their health and disease predisposition than their genetics. And during that time, you are the sole source of nutrition for this growing baby during pregnancy and breastfeeding. And I'm often amazed that people spend days, weeks, if not months, decorating the nursery, ready for the new baby to arrive. But the most important nursery you will ever have is the one inside you. And we really need to make sure we nourish that properly, because being the best mum starts well before birth. So what I'm going to do today is go to highlight some of the most important nutrients, why they're important, and also the best sources, first dietary sources versus supplementary sources. And as I was saying, I'm the owner and director of Zycia, and my reason for starting this company was really to create a resource for women that was trusted. What I found out that when I was wanting to conceive, in this age of the internet, getting information is really easy. Getting the right information can be hard. So when I'm doing all these research, what I wanted to do is put it in a format that's trusted and nice and easy to find out. So this one, you've probably all heard of folate. I don't need to tell you what this is. But most important thing about folate is the body can't produce folate. We are totally reliant on dietary sources to get enough folate. It is involved in DNA creation. In actual fact, we can't carry a pregnancy if we don't have enough folate to create that DNA. And it also supports healthy neural tube development and prevents birth defects like spina bifida, which is probably the main thing we hear about folate and folic acid. But the other thing I get asked, okay, we hear about neural tube defects, etc., but what is actually the neural tube? What does it do? The neural tube connects the brain and the spinal cord. So as you can imagine, it's really important to get that fully developed, otherwise the brain is not communicating with the rest of the body. If there is a defect in that spinal cord, the baby will either miscarry or it can have birth defects, which will mean it cannot walk. There's different degrees, but it can be quite severe, and a simple nutrient such as folate can help to prevent those defects and help support that growth of the neural tube. The scary thing about this neural tube development, the reason why I like to get onto people nice and early, even before they conceive, is that neural tube develops and closes during the first 5 weeks of pregnancy, which is before some people are even aware they are pregnant. So it's really important to start boosting your intake as soon as you begin thinking about the baby. And in fact, all of your baby's organs are formed by week 10. The rest is just development. Now, as a naturopath nutritionist, I really advocate dietary sources are really important. But why I also recommend supplementation of folate is because folate is one of the most unstable nutrients. What that means is if you heat it, if you process it, if you cook it, you will lose most of your folate. So unless you're going to the veggie patch in the backyard, which I wish I was, but these days a lot of our food is shipped, is frozen, is thawed, so we just can't exactly guarantee how much folate is in our food. And for that reason, a lot of our foods fortify with folic acid. Now, a lot of people use those terms interchangeably, folic acid and folate. Folic acid is the synthetic supplementary source of folate, which is the natural nutrient which is found in our food and is used by the body to help in this development. And there's actually quite a long metabolic process for the metabolism of folic acid to folate. And what they're finding is there's new active form of folic acid, which is already available in prenatal supplements in Europe and America. Basically, it's a better absorbed form of folate. And I can show you the difference here. Folic acid takes 4 metabolic steps in the body to reach folate, which is the nutrient that we actually need. There's a common polymorphism that affects around 50% of the population of this particular MTHFR gene there, which makes it difficult to get that final step of the metabolism of folate, which means that though you may be taking a supplement of folic acid, you may not be getting sufficient folate, which is the nutrient you need. So when you're looking at supplements, the ideal source of folate is calcium folinate, which is known as an active form of folic acid. It's basically further down the chain and just maximizes your folate uptake, which is so important for that development. The RDI during pregnancy is 400 milligrams, which most supplements should contain. So that's what you should be looking for. Now, this is a nutrient, unlike folate, that most people look at and go, sorry, what is that? Is that a vitamin? Is it a mineral? This is actually a member of the B vitamin family. And in the US, it's been hailed as the rock star pregnancy nutrient. They do tend to get carried away about these things, but it is massive in the US, but it's just starting to hit our shores, the information. Choline is involved in the development of acetylcholine. Acetylcholine is one of the neurotransmitters in the brain that helps our cells communicate and talk to each other. So as you can imagine, if you can support that development through the intake of choline, you're helping to support learning, memory, cognitive function, and basically optimizing brain development during that critical time. So basically, choline helps to keep our cell walls healthy, our cells healthy, and allows them to chat between themselves, which is really vital for that communication in the brain. There's also a lot of recent studies linking to improvements in Down syndrome dysfunction, reduced risk of schizophrenia, reduced Alzheimer's risk, and also improved learning and memory capacity of the infant. And I've just got a few quotes for some of the researchers here, which I find quite amazing. And this one's from Professor Barbara Strupp of Cornell University, who I communicate with in New York. While older pregnant women are generally tested for a Down syndrome fetus, younger pregnant women are not, since their risk is low. However, development of all fetuses, Down syndrome or not, would benefit from choline supplements during pregnancy. And she also goes on to say that there is mounting evidence suggests that many women may not be consuming enough choline during pregnancy to promote optimal brain development and cognitive function of their babies, both normal and Down syndrome, and increasing choline intake during pregnancy is sound nutritional advice. This is also another one from the Review of Journal of Pediatrics in America again. Choline in the diet of the pregnant mother and infant is directly related to permanent changes in brain function. Without enough choline during the critical time of brain growth and development, intelligence, memory, and possibly mood regulation will be damaged permanently. So we might not be able to measure the exact impact on IQ or other brain functions, but we do know enough at this point to start preaching the choline message. And that's the main thing I want to get across, and that's my main reason for developing this company, is to get across the message about the importance of these particular nutrients. It's also essential for neural tube development. So as we're talking about the importance of folate during those critical first 4 weeks, choline also helps to reduce your risk and support that development. Again, dietary sources. I really want to advocate dietary sources. The unfortunate thing about choline is why a lot of people aren't getting enough is that it's mainly in fatty sources. So it's in egg yolks, it's in a lot of your meat-based sources, and your vegetarian sources are generally lower. So that's why they're suggesting during pregnancy it's too important to just rely on our dietary sources. A supplementation, I see a supplement as an insurance policy. It maintains a baseline of all your essential nutrients, but it will never and should never be a replacement for a healthy diet. So the recommended adequate intake of choline during pregnancy is 440 milligrams, so that's what you really should be aiming for. And actually during pregnancy, it increases to 550 milligrams because as you can probably imagine, when that baby comes out, their brains are just sponges. You really need to support that development through the intake of choline, so it actually increases. And on the Zycia website, you can log on and see lots of nutritional recipes that are high in all these foods as source nutrients as well. Now, this is one, if you're pregnant, breastfeeding, or even thinking about it, or probably just if you're a human being, you've heard of vitamin D. Everyone seems to be deficient in vitamin D. And it's really important during pregnancy for its role in bone development. How it assists bone development, it supports the intake of calcium into bones. It's all well and good getting calcium into your bloodstream by taking a calcium supplement, but if you don't have enough vitamin D to take it into the bones where it needs to go, then it's not being effective. So vitamin D helps the absorption of calcium, and it's also really important during the later stages of pregnancy. And research shows that women who have higher levels of vitamin D during pregnancy do have a reduced rate of complications such as gestational diabetes, preterm birth and infection. So it's really important not only for the health of your baby, but also for the health of the mum as well, which is really important. And the recent study Sydney study actually showed that the deficiency is an increasingly common condition in up to 80% of pregnant women. And I have to say, the obstetricians that I deal with and speak with, most of them would say 100% of their pregnant women are deficient in vitamin D. So it is a nutrient that we really need more of. But the biggest question I get asked is, surely we live in Australia, aren't we getting enough from our sunlight? Well, actually, Australian and New Zealand guidelines are now recommending supplementation over sun exposure. Because the hard part is they used to say, okay, half an hour a day is enough. For some people, that may be too much. Are you fair-skinned? Are you wearing SPF in your moisturiser? What time of day are you going out? Also, people have different metabolisms of vitamin D. Some people during winter metabolise no vitamin D through their skin at all, whereas some people are able to convert it really well. So there are too many variables to exactly quantify how much sunlight exposure is enough. So that's why, particularly during these critical months of pregnancy and breastfeeding, taking a supplement, again, is like your insurance policy to make sure you've got sufficient. Because dietary sources are very minimal for vitamin D. Some of the others, I've just put up the highest ones, but vitamin D, this is pretty much nearly all of them. The recommended intake during pregnancy is 600 milligrams, which is what you should be aiming for. Some women are needing up to 1,000 or 1,500. So 600 is the minimum. Iron, it is another buzz nutrient during pregnancy that everyone is told to get more of because it works in combination with both folate and vitamin B12 in the development of our DNA, which of course is absolutely vital to the growth of a baby. We have heme and non-heme sources, which is your meat and your non-meat-based sources. Meat-based sources are directly taken up into the body, whereas vegetarian sources are selectively taken up. Because our ability to absorb iron actually increases during pregnancy, a lot of people can maintain sufficient from vegetarian sources. So as long as you combine well, you can actually get sufficient iron from your vegetarian sources. When you're supplementing, I'm often told, I can't take iron, it makes me constipated, I feel sick, I feel nauseous. Iron shouldn't constipate. It's the form of iron and the dose that you take it in that can cause those side effects. There are 3 different forms of most common sources of iron, are a ferrous sulfate, a ferrofumarate, and an amino acid chelate. The latter one is the one you want to be looking for. What that means, it means it's chelated. It's broken down into a form the body can recognise and absorb. If you are becoming constipated, it means it's sitting in your gut, it's not reaching your bloodstream. That's not effective for anyone. So when you look for a chelated source, it just optimises that absorption into the bloodstream. Because it's all well and good having nutrients listed on the packet, having put it in the tablet, but if those nutrients aren't reaching your bloodstream where they can be effective, they can have detrimental effects on you, and they can also be ineffective, which is not what we want out of our supplement. So the recommended intake of, that should be iron, is 27 milligrams during pregnancy. And it actually is 18 milligrams when you're wanting to conceive or during conception phase. So the other thing is, although iron is important during pregnancy, it is a heavy metal. We need to remember that our body has no means to which excrete it. So we shouldn't be taking too much. The upper safe limit, as recommended by Australian and New Zealand guidelines, is 45 milligrams. So unless deficiency has been diagnosed, you shouldn't be taking that much of a heavy metal in your system. Also, if you do need to take a higher dose because you do need to boost your levels, the ideal way to do that is take it in divided doses over the day. A big whack of a heavy metal is very difficult for your body to absorb and can also exacerbate constipation and nausea, which is already an issue during pregnancy anyway. Iodine's the other one I want to briefly touch on. We know how important iodine is for intellectual development. In fact, it's one of the most common forms of intellectual impairment worldwide, iodine deficiency. So this is something you really want to be supplementing with. Similar to vitamin D, there are very few dietary sources of iodine. So supplementation is highly recommended by the World Health Organization. And the RDI during pregnancy is 220 micrograms. So you want to be providing at least that. You'll find most supplements provide between 220 to 250 milligrams. If you're interested in anything more information of what I've been saying today, the Vitamins Guide is available at the Zycia stand. Why I created the Vitamin Guide, as I said originally, my background is in product development. And what I was finding is there's a lot of big companies who make vitamins to a price, not to a health outcome. This company was designed and developed for my baby, basically. So everything in there is designed and is the best nutrition possible. So the Vitamins Guide, what it does is basically teaches you how to not look at the front of the packet and see all the advertising jargon and why they want you to buy the product. Look at the back of the label. What are you actually getting? And also there are a lot of different forms of nutrients, as I was just saying then. There are about three or four different forms of calcium. There's 3 different forms of iron. There are a lot of differences in those different forms, and there's a lot of difference in the price. So it just enables you to make informed decisions about your health and your families by looking at the back of the packet and what you're actually getting versus what the marketing spiel is telling you. So you can also join on the Zycia website at zycia.com.au. We also have a Facebook page where we update weekly recipes that are high in folate, high in choline, high in vitamin D and all those important nutrients. And you can also follow us on Twitter. I also have a blog where I mainly post a lot of clinical studies and anything new that's coming through in relation to vitamin D, choline, etc. So if you're wanting more information on some of the new nutrients out there and what they can do for your baby, tashajenningsnutrition.com, which you can get to also through the Zycia website. So thanks for your attention. And finally, this is the reason this company came about. So I'm not a big company. We're not a massive multi-million-dollar company. This is the sole reason this company came about. I want to be able to provide the best nutrition I could for my son, and I want to be able to pass that information on to other young mums like myself. So thanks for your time.